At Creative Healthcare Management, we have several programs that help build that culture of relationship-based care. So one of our programs is called Reigniting the Spirit of Caring, and it really focuses on that care of self, care of colleagues, and how that then leads to a better patient care experience. And so we spend the first day really focusing on what can you do to care for yourself? What does that look like? What do you do now? What other things can you do to care for yourself? And then we start talking in the afternoon of day one about how do you care for each other and the strength of the interprofessional interdependency, we like to call it. So if you know the story of the redwood trees, we talk about that in RSC. And so the redwood trees, if you've ever been out to California or have seen pictures, they're these huge, gigantic, tall trees, right? But they actually have a very shallow root system. They're going to think, wow, if it's a shallow root system, doesn't that make it like really likely to fall over when a strong wind blows by? And you know what? They don't fall over, right? Because that shallow root system, those roots intertwine with each other and they connect together. And that's why the redwood trees are so strong. And so it's just like a good team. When you connect and, hold on to each other, you're a strong, capable team. And so that's the importance of caring for your colleagues. And then that all then leads to that third relationship of caring for the customer, caring for the patient and their family. And we actually bring in a patient and a family member to talk about their experience. And sometimes they're good experiences, sometimes they're not good experiences. And you know what? We learn from those as well. Sometimes we don't realize that the things we say or the way we act and how that can impact that patient. I had a family one time tell us about their experience. Their son was a traumatic upper arm amputee. And the mother, I remember her plain as day saying, you know what? I listened to what the nurses and the doctors are telling me about how my son's doing. But then I watch them as they walk away. And if they put their head down, I know it's not good. And if they keep their head up, I know my son's doing okay. And so it's really understanding that perspective of the patient. And so it's so important that we have patients and families or a customer that comes in who has experienced us and tells us what really worked and what maybe didn't that we can look at and improve. And then the third day, we all kind of come together and talk about what we've learned over the first 2 days and what are we going to change personally and together moving forward. So what is my personal action plan going to be? And then what is our team action plan going to be? What as a team can we do to support care of self, care of colleague, and care of the customer within our department? So RSC, the comments we have gotten from that, we've had people say, you know what, I was ready to quit and my manager made me come. And oh my gosh, I am re-inspired. I am ready to get back out there. I am so glad I came. And we have people who go to Reigniting the Spirit of Caring on their own every 1 to 2 years because it's the way they refill their cup. It's part of their self-care, part of their professional self-care. So I love that about Reigniting the Spirit of Caring.